Arteries and veins are two types of blood vessels that perform distinct yet complementary functions within the circulatory system to transport blood to and from the heart. The key differences lie in their structure, the direction of blood flow, the pressure of the blood they carry, and the oxygen content of the blood, with a few notable exceptions. Arteries are blood vessels that carry blood away from the heart. Direction of flow. They transport blood from the heart to the rest of the body. Blood pressure. Arteries have to withstand high pressure from the heart's pumping action, which is why they are thicker and more muscular than veins. This high pressure also creates the pulse you can feel in your wrist or neck. Structure. The walls of arteries are thick, strong, and elastic to handle the forceful blood flow. They have a thick middle layer of smooth muscle and elastic fibers that allows them to expand and contract, which helps regulate blood pressure. Oxygen content. With the exception of the pulmonary artery, which carries deoxygenated blood to the lungs, most arteries carry oxygen-rich blood. Veins. Veins are blood vessels that carry blood back to the heart. Direction of flow. They return blood from the body's tissues back to the heart. Blood pressure. The blood pressure in veins is much lower than in arteries. Structure. Veins have thinner walls with less muscle and elastic tissue. Since they are working against gravity to return blood to the heart, many veins, especially in the legs, have one-way valves that prevent blood from flowing backward. Oxygen content. With the exception of the pulmonary veins, which carry oxygenated blood from the lungs to the heart, most veins carry oxygen-poor blood. The circulatory system can be simplified into two main loops: systemic and pulmonary. In the systemic circulation, arteries carry oxygenated blood to the body's tissues, while veins return deoxygenated blood to the heart. In the pulmonary circulation, the roles are reversed. The pulmonary artery carries deoxygenated blood from the heart to the lungs, and the pulmonary veins carry oxygenated blood back to the heart. The human heart has 4 valves that act like one-way doors, ensuring blood flows in the correct direction through the heart's 4 chambers and out to the body and lungs. These valves are essential for the efficient pumping of blood. The 4 valves are: tricuspid valve, located on the right side of the heart, between the right atrium and the right ventricle. Function: it opens to let oxygen-poor blood flow from the right atrium to the right ventricle. It then closes tightly to prevent blood from flowing backward into the right atrium when the right ventricle contracts to pump blood to the lungs. Pulmonary valve, or pulmonic valve, also on the right side of the heart, located between the right ventricle and the pulmonary artery. Function: this valve opens to allow blood to be pumped from the right ventricle into the pulmonary artery, which carries the blood to the lungs to pick up oxygen. It then closes to prevent blood from leaking back into the right ventricle as it refills.